David Trombetta can now run with confidence. The heart attack survivor knows he has a personal paramedic right in his chest.
We're living in the 21st century, and it's kind of like being Iron Man, I guess. You know, you got the atomic heart going, and it's pretty cool.
What he has is this unique defibrillator that is the focus of a clinical trial at Salinas Valley Memorial.
David had a heart attack, and that happened a while ago, but what it led is to weakening of his heart muscle over time. And we know, based on a lot of other trials in medicine, that those individuals are the highest risk of having what we call sudden cardiac arrest or sudden death from an arrhythmia. And this is an internal cardioverter defibrillator, something that's easier to say, ICD. And these are devices that allow you to then get a shock, get the heart back to normal rhythm, rescue you so that then you can get more advanced medical care.
Standard internal defibrillators have metal in the devices which prevent patients from being able to have MRIs.
This is a trial of a new device that has been designed to be put in someone who could then have an MRI.
He brought up the clinical trial and asked me if I'd be interested and explained the advantages of this new defibrillator, and I was very excited to try and get in on that. If I was going to do it, I wanted to have the best and the newest and the most exciting.
We're dealing with many different issues when we're looking at a patient, both what's going on with them now and what could happen in the future. And what we know is that over 3/4 of people in their lifetime are going to have an indication for an MRI.
I had some work done on my neck. I hurt myself a while back, and there's always the chance that part of that might have to be looked at again, and if they have to do that, that's going to require an MRI. So knowing that I can get that technology if I need it is very reassuring.
It's a good sized trial for a device trial, which is where you're testing new equipment or pacemakers. There's almost 300 patients that are going to be enrolled worldwide. Ultimate goal is to show that this is an effective, safe therapy for patients so that we could be offering this to everyone who comes in.
You know, it's funny, when I had my heart attack, I thought for sure I'm going to have to go somewhere else, and being able to get that care here and then being able to get the defibrillator and the trial in Monterey and not have to travel to do it was great.
Exciting to me that we can bring this technology to this community, and that's really kind of been my goal here as a director of this center, is to not just provide day-to-day care, which we want to do at the highest level, but also really provide technology that very few places in the country or the world can.